The World Health Organization has urged the protection of the elderly in Africa amid the coronavirus pandemic. Aged people in Nigeria and Sub-Saharan Africa remain one of the most vulnerable groups. This is because they are the most impacted by poverty, with no forms of social security or adequate policies to ensure their welfare. World bodies are now calling for the consciousness of everyone on old people, their vulnerability, right, and need for care. Let's bring in a consultant geriatrician, Dr. Olutoyin Ajala, who joins us from the United Kingdom for more perspective on this. A report by the World Health Organization says violence against older people rose sharply since the beginning of the COVID-19 pandemic and, of course, imposition of lockdown measures. And now the World Health Body and other groups are calling for the protection of the elderly. Help us better understand these concerns.
As you know, there really isn't much support for the elderly in sub-Saharan African societies. I'm not saying the society by itself, I'm saying really the government and government organizations. The most important thing, though, is that awareness is being raised now. And what we actually just need is to put in place government strategies that would help us to protect the elderly people from abuse. Elder abuse is common and is rife because it's, first of all, it's not recognized. And then secondly, there's really no law. There's no law against it. There's nobody that actually enforces this in the government. The society at large just needs to be made aware of all of this, and there needs to be more government guidance and government legislation on protecting the elderly people.
All right. As it is today, governments around the world are battling the pandemic, and there's some serious economic crisis. How exactly can, say, individuals, groups within societies, how can they support government to attend to this vulnerable in our society?
I think one good thing about our society is that we're very charitable. You would see that around us there are lots of charities, especially for young people, widows, for displaced people. Now is the time for us to get together and have more charities for elderly people. So people like myself, geriatricians, people who are vested in elderly people, we've all recognized that, and you see that now there are quite a few foundations and charitable organizations coming together to try and do things that would better the health and well-being of the elderly. It's something that I personally am championing as well, because the government is stretched. They're not really able to provide legislation or provide much support. There's barely any government support for elderly people. So we all just have to get together as societies, people championing this cause, and just together working with the local government areas, working with the communities to identify vulnerable elderly people and just try and work for them and protect them from abuse.
Our consultant geriatrician, Dr. Olutoyin Ajala, thank you for talking to us on TVC News at 7.
Thank you.